Gracefully Graying. I am your host, Attorney Henry Gornbein. Today on Gracefully Graying, we will be discussing a very critical topic as we look at ways to deal with this horrible drug crisis that has been impacting on so many of our people on a nationwide basis with my guest, Dr. Arun Gupta. Dr. Gupta, welcome to Gracefully Graying.
Thank you, sir, for inviting me.
Well, it's a pleasure, and we look forward to a lot of information that you have to share with us. First of all, tell us a little bit about your background.
So I was born and raised in India. After finishing my medical school, I came to America. I got married in Chicago. I've been doing primary care physician work since 1986. For the first 3 years, I was working different odd jobs as a physician in Detroit. And finally, I started my solo practice in Monroe in 1989. I have been a deputy medical examiner also for 8 years in my early part of the career. And for 11 years, I served as a jail doctor. In 2006, I started learning addiction medicine. And about 10 years ago, I started sharing my concerns and knowledge with anybody who wanted to listen to what's going on with the addiction and the drug problem in this country. 4 years ago, in 2017, I was faced a question asked by a senior colleague, when is all this going to end? And I did not have a very good answer. And I started wondering why and what can be done about it. And some of my physician friends who had heard my presentations suggested that I write a book, and it is called The Preventable Epidemic. We can talk more about it. And I'm trying to raise awareness in the public in general. Yes, thank you.
Well, this is such an important issue, Dr. Gupta. And I recently read that in the last 12 months, over 100,000 people died from drug overdoses. Why?
Well, it is very unfortunate. This is, first of all, a 40% increase in the overdose deaths from pre-COVID times. And it's primarily right now because of the illegal fentanyl that's being laced into different kind of medications with heroin, OxyContin, marijuana, cocaine, even prescription medications. Unfortunately, 80% of the patients that have addiction problems do not have access to cares like doctors like me. That is the main reason.
What are some of the risks of dying from drug overdoses here in the United States?
So the drug overdose deaths are very common in the ages of 18 to 54, and they have the highest risk. We had a 1 to 2% decline in 2017 and 2018 when we're pushing too much Narcan. And with COVID coming on and people are more stressed, access to care is very limited, the mortality went up. So the risk of dying is very high in this population, yes.
What is the estimated number of people who have died here in the United States from drug overdoses during the last 22 years, Dr. Gupta?
The CDC and SAMHSA has started recording these deaths from 1999, and I added up year by year, and it's close to 1 million people that have died, which is directly related to the overdose deaths. Now, I've been a doctor and a medical examiner, and the death certificates are signed in the way the patient presents to the emergency room. If they have trouble breathing, they put a breathing tube in the throat and they die. So the cause of the death is recorded as respiratory failure. So I'm afraid the real number of deaths may be 3 to 4 times higher than what the government has recorded.
Dr. Gupta, you have become an expert in this area, but is addiction training part of medical school or residency programs?
Unfortunately, there is no education in America in medical schools or residency programs. I looked at the curriculum from graduate medical education training. There is none so far. And I self-taught myself starting in 2006, and physicians are expected to do that. There are about 10 to 15 physicians that were being trained until 2015. With new funding, the number has increased this year to about 100 doctors that would be trained in the next year or 2 or 3, and in 5 years is expected to be 1,000 more.
We clearly have an epidemic, Dr. Gupta. Do we have enough doctors here in America to deal with this drug epidemic?
The answer is clearly no. We have about 40 million people at risk of dying from drug overdose. There are only 18,000 providers like me or with more qualifications than me that are interested in doing this on an active basis. And we treat about 2 million people. Rest 20, 30, 38 million people have no access to care. And so it is not a very good situation.
Dr. Gupta, how many people are in treatment for opioid problems here in the US?
CDC and SAMHSA do not share those numbers. My estimate is about 2 million people only are in treatment, and most of them are doing very well.
How many patients do you estimate are at risk of dying from opioid problems here in the United States?
Well, so CDC and the government statistics talk between 20 to 40 million people. Based on my knowledge and experience, I think it's upward of 40 million people. And if we lost 100,000 this year, and the number is jumping 40%, we could lose good 30, 40 million people in the next decade.
What is DATA 2000?
So CDC first recorded in year 1999 that 16,000 people had died from poisoning. Of that, 4,000 were clearly from multiple drug overdoses. Others were from other causes of poisoning like alcohol and stuff. So the 106th Congress debated for 2 years from 1999 to 2000, a bill by the number of HR 2634. And after debating, they passed a law called DATA 2000. This DATA 2000 allowed that any practicing doctor in any field could take a course, pass an exam, and then apply for an XDEA number, and they could be labeled as addiction providers. So I learned addiction starting with that pathway. It's called DATA 2000. Unfortunately, most doctors, even until today, do not know what that is. And the government did not want it to change the curriculum, I guess, to start teaching addiction in medical school, because it takes 6, 7, 8, 10 years from a doctor to start till the finish to do it. And it would take a lot more teachers and programs to do that. So instead, the DATA 2000 was started, and I estimate at this point, 95% of the doctors are not aware of it. Unfortunately, this bill was not aggressive enough to entice doctors into learning addiction. At the same time, there were significant limits in the number of patients a doctor could treat in a given month. There is oversight by DEA in these programs and unnecessary regulations imposed on the doctors. This made doctors very uncomfortable to learn and practice addiction medicine in the last 20 years. As a result of these regulations, 1,000 doctors have been shut down and taken out of business and face serious legal consequences for writing too many pills and running pill bills. 1,600 doctors have committed suicide for working in very stressful circumstances, and others pay attention. So the rest of us are trying to stay away from taking care of these difficult patients. In the same DATA 2000, there's lines that I'm going to quote. It says, void of any supporting science, caps the number of addicted patients a physician can treat at any one time to 30 through the first year, following certification expandable to 100 thereafter. No other medications have such restrictions, including the prescription drugs people get addicted to or die from. Like many well-intended laws, the unintended consequences are significant. So the federal government felt it was a wrong law, in my mind, they're passing, but they had to pass it because of compromises how the government works. And it clearly showed that this was not a good law.
Dr. Gupta, tell us about the barriers in treatment for addiction.
There are several barriers, but the three important barriers in my mind. One is the enforcement, which came with the Harrison's Narcotic Act of 1914. It says in the course of their professional practice, a doctor cannot treat an addictive condition with another addictive drug. So that line draws all the new regulations. But if there is no non-addictive medication, then we have to use what we have. Methadone is being given for last 50 years, and suboxone has been available for the last 20 years. But we don't have good outcomes because there is not, that's a barrier in the legal language. So
I'm
a law
curious.
and order,
Go
a
ahead.
law and order approach has not worked for the 100 years, and it must change. The second barrier is stigma. There is stigma towards the disease, and there's stigma towards treatment. So Supreme Court said in 1962, addiction is a chronic treatable condition and is treatable. We are still letting people die thinking they have a moral problem. And the insurance companies and law enforcement has not done anything to change that outlook. The third barrier is they put a diversion control plan on the treatment arm, which is called suboxone. So the pills that cause the problem, the street drugs, they're freely, easily available, and people are dying from it. The treatment arm has a diversion control plan, and if patients go and sell their drug, then doctors get in trouble. So there should have been this diversion control plan on OxyContin and pain pills in the first place 20 years ago. So those are the three main barriers.
Yeah, I'm curious now, isn't not only you have the issue with regard to the factors you've mentioned, what about denial? What about the fact that so many people who are addicts, whether it's to opiates, whether it's to heroin or other drugs, are in denial, won't admit it. So
yeah, so what happens is I don't watch much TV, but most of these shows that you watch on TV, A&E and other programs, they just show the doom and gloom. They don't show the people in recovery. I have hundreds and hundreds of patients that are doing very, very well. We can talk about it in a minute. But if addicted patients see the good stuff, then they get motivated. If they only see the dirty stuff, another person dying with a needle in the arm, they don't have food, they're filthy, they don't have a place to stay, they're gonna want to stay in that situation. The media needs to show the good side of the treatment.
now, Dr. Gupta, you mentioned methadone. Isn't that replacing one addiction with another, so to speak?
No, this addiction is a chronic disease in the brain, like sugar, diabetes, hypertension, you're gonna need medication. So replacing one with the other is not important when 100,000 people died this year and we lost 1 million. My patients don't die. My success rate is 85%.
Now, what is suboxone?
Suboxone is a combination of two medications. It was approved in America in 2002. So this is how I explain. People know the HIV and the AIDS problem. That started in early 80s. For 15, 16 years, we did not have an effective medicine available. And 500,000 Americans had died. In 1996, HAART treatment was approved and is very effective. And since then, 400,000 people are alive and well if they stay on the treatment. And there's ways to keep people on treatment and keep a track of them. So I would have expected, any physician should, once we have an effective medicine approved in America for the addiction, then people should be not dying. People should be in treatment. But the treatment is very limited, restricted, and overly regulated, and the patients don't want the treatment, and we don't have resources to treat them. So that's the problem with the suboxone, is it's overregulated.
Okay, Dr. Gupta, when someone is admitted, whether it's to a hospital or a treatment center for drug problems, what follow-up is there done by an addiction doctor, and what is needed?
So when I started in 2006, the number of addiction providers in this country was 6,000 only. So imagine if we have only 100 people in the entire state of Michigan, and there are hundreds and thousands of people, and so the hospital is only interested in taking care of the patient when it's there. If you go to the hospital with a sugar of 600, you not only need a drip to bring the sugar down, you're going to need the medicine to take for the rest of your life. So there was no connection because guys like me were not available. They're still not available enough. But these people, to stay in remission and not relapse and not die, they're going to need this suboxone type medication on a long-term basis for the rest of their life in most cases.
What about rehabilitation? Can these patients, when they're treated, be rehabilitated to become productive citizens, Dr. Gupta?
This is an excellent question and one of my favorite questions. Most of my patients have improved their education. They have better jobs than they were when they were addicted. They don't get fired. They get raises. They have better skills. They're taking care of the families. They're going to church. They're going on vacations. They have bank balances. They're buying new houses. And uh, and they're very happy to be united with the family. The generations above and below come and thank me that thanks for saving our young one.
So you've had a lot of success. Now,
Yes.
You've written a book, Dr. Gupta. First of all, what is the name of the book?
It's called The Preventable Epidemic, a frontline doctor's experience and recommendations how to resolve America's opioid crisis. In this book, I'm providing workable, practical solutions to resolve the America's opioid problem, and is expected to be coming out in February of 2022. I explain in this book how regulations have been misdirected, leading to a very devastating and unpleasant outcome over the past 20 years. These are serious problems because of over-regulating addiction medicine, putting limits on how many patients an addicted doctor can see, and in no other field of medicine these restrictions exist, and certainly not necessary considering we have lost 1 million people and death rates have gone up about 40% this year.
Dr. Gupta, what was the reason that you wrote the book?
Well, so with the COVID going on, we're talking a lot on a larger scale about humanitarian and peace projects. And I think this is the biggest humanitarian peace project. And I have been disappointed and disgusted to see misery in our communities for the last 15 years. Currently, 275 young Americans die daily from accidental drug overdose. The biggest cause is the fentanyl being laced with different kind of medications, both street and prescription. We're losing soccer moms and suburban dads innocently these days. People do not understand that the street drugs are much more lethal and easily can be deadly. I thought the drug crisis was bad 10 years ago. At that time, 100 people were dying daily. Now it's 275 per day. Because of the current regulations, doctors are being prosecuted. We are restricting prescription-grade drugs. That would have helped 20 years ago. Right now, patients need doctors and prescription-grade medicine so that patients are not forced to go to the street and get the deadly drugs. Regulations since 2000 have not helped. They have made things worse in my mind, and they've been counterproductive. In my practice, I have a success rate of about 85%. People stay in remission, and several of my patients are stable and doing very well. And media needs to look at it. My goal is to raise awareness to save young American lives. I'm tired of seeing people dying from preventable disease that is treatable. It is much easier to save these lives than the COVID lives. And in 2017, CDC reported 700,000 people had died from 99 to 2017. And that year, the death rate was 70,000. I was really asked a question, when is this all going to end? And the spontaneous answer I got was when everybody dies. And I looked at the person who asked me the question, and she looked at my face, and I told myself, we got to do something about it. And that was the reason I started writing the book and giving more lectures. And since it was not making a bigger difference at a bigger scale, so here we're talking at a bigger platform.
Dr. Gupta, who is your intended audience?
So the audience at this point is not the person who's in the basement doing drugs and have no access to anything. The stable patients would love to read it. Their families would love to read it to see what's going on. And the ones who have lost loved ones. The medical community, the nurses, the doctors, the paramedics, the law enforcement, schools, colleges, churches, we all deal with this kind of problem, and the media is very silent. We need to wake them up. The insurance companies are paying tremendous bills in overdose treatments in the hospital. We have programs around the country. The bureaucrats need to understand this, the policymakers, the DEA, SAMHSA, licensing and regulation. And finally, the state and federal government need to pass the laws to favor this. The big corporations have very unstable, and small employers have very unstable employees because of the addiction issues, and they would all benefit if we can rehabilitate 40 million people who are addicted and are not able to function. Then we have a big workforce that will do well for the country.
Dr. Gupta, what are some of the things, other goals besides the ones that you mentioned so far with regard to the book that's you've written that is about to come out?
So my first goal is to reverse the trend of the overdose deaths. So instead of keep on going up, we need to start bringing it down as close to zero. We have 10% of the US population at risk, which is about 40 million people that could be wiped out in the next decade or two. And our children and grandchildren are at risk. And I asked myself, how can we do nothing? So when I started researching this in '99, 40 people were dying from drug overdose. 5 years ago was 100, and now it's 275 per day. All the news is informational. Nobody knows the solution. Nobody's talking about it. We need to improve and resolve the opioid epidemic. And that's why I wrote the book, and we're starting a foundation about that.
What are some of the things we need to do to change in order to start saving more lives and dealing with this epidemic?
So we need to have all the 40 million people at risk in treatment with medication-assisted treatment for addictions. Luckily, there are 106,000 providers like me who have limited knowledge, but have a license and credentials to treat addiction. There are only 3,000-4,000 board-certified addiction doctors, but they cannot see 40 million people alone. So we need to encourage the 90,000 plus providers who are sitting on the sidelines because either they don't have resources or experience or desire, or they're afraid to get in trouble with the laws. So if 18,000 of us could contain 2 million people, 106,000 could easily go to 15, 20 million overnight. But we need to make them comfortable and provide them the resources to take care of the addicted patients. We need to reverse the regulations that prevent access to care. And I say the law and order approach has not worked for 100 years, it's not going to work. So I would let the doctors become the doctors and let everybody else who's not a doctor get out of the way and let us take care of the patients, yes.
So there's a lot that has to be done. One area that's of interest to us at Gracefully Graying is the fact that I know that with those who are elderly and often those who are either repeatedly hospitalized or often in assisted living facilities, there's a tendency to over-medicate, whether it's with prescription drugs or whether it's some of the harder drugs, especially for pain management. What are your thoughts on that issue?
I have always struggled with that problem. So what happens is patients have one complaint, diabetes. So you could treat with optimally one medicine, or you could go 2, 3, 4 medicines. Similarly, for a heart condition or blood pressure. The more medicines we throw at the patient, the more side effects the patient is going to have. Then the doctors end up writing more medications to counteract the side effects. I think with diet and exercise and some behavior modification and controlling the symptoms in other way, we can reduce the medications. But it's very time consuming. It's no reward to the patient to write less medications than more medications. So it's easy to, you have a fever, you got cold, you got cough, here's another medicine. So our society is instant fix. I got a symptom, I gotta get it fixed. So once the mindset is wrong, the expectation is wrong, it's gonna not reverse easily.
So it's a matter of really looking for alternatives to drugs, not only with regard to addiction, but with regard to the fact that we tend to over-medicate our elderly as well. We have a little bit of time. What are some final thoughts that you would like to share, and maybe some takeaways for our viewers to remember some of the key points that are most germane to your book and to what we've been discussing, Dr. Gupta?
So my takeaway is the street drugs are cheaper, deadlier, easy to find, And then now fentanyl is being mixed with anything that they can find. Soccer moms and suburban dads are dying innocently. Addicted patients do not have access to care in more than 80% of the time. We do have effective medicine available in America since 2002. And despite that, we have a 40% increase in death rate this year from pre-COVID times. Addiction is not a moral disease. It is lethal, chronic, relapsing, treatable disease. And even the Supreme Court ruled it in 1962. The barriers we mentioned earlier need to be removed so that we could come up with a better treatment program. Failed and counterproductive regulations should be expunged. And if we do not fix this problem soon, 10% of the population is at stake of dying in the next decade or two. It is a treatable, fixable problem. We need to adapt and practice the solution as I outlined in the book. We all have to be convinced, everyone involved, to fix this crisis. I provide the solution. I've tried in my practice for the last 15 years, and my success rate is 85%.
That's important. And you're sharing some important issues with us. And all I can say is we wish you great success with your book and what you're doing. And another thing, it seems that we've got to decriminalize a lot of this, because these are, as you say, they're illnesses and they've got to be treated as such. So I want to thank you so much, Dr. Gupta, for sharing these important thoughts on this critical epidemic that we're facing. So I want to thank you so much for being our guest on Gracefully Graying. And I want to thank our viewers for watching Gracefully Graying.